that out of the total diabetic population, hardly 5 to 7% are type 1 diabetics, but unfortunately, 1 in 6 youngsters die without getting diagnosed as a type 1 diabetic. In today's video, we are going to talk about what are the causes, symptoms, how do we predict whether you are prone to become a type 1 diabetic. I'm Parimala Jaggesh, a nutritionist and a diabetes educator, also the founder of Alamirap Nutrition. Since we started our company, we find a major uptake in the number of youngsters who are getting diagnosed as a type 1 diabetic. Initially, type 1 diabetic was called as juvenile diabetes or insulin dependent diabetes, and it was sort of earmarked for children only. But these days, we find the incidence also increasing in adults. So how do we know whether our children can become a type 1 diabetic? It is quite difficult to predict because type 1 diabetes is a health condition when your body, there's an autoimmune reaction and the good cells in our pancreas get destroyed because of this autoimmune reaction. When the cells in the pancreas get destroyed, insulin production almost comes to a stoppage. So this leads to a condition called type 1 diabetes, and the only treatment presently available is insulin replacement therapy throughout the life. So is there any way we can predict who can become a type 1 diabetic? Unfortunately, no. There are two things which a parent can look out for. In case, in your genetics, if anybody in the family has already been diagnosed as a type 1 diabetic, then yes, please do watch out for that symptom. And the second one is something which we can't control. There are some viruses that destroy the pancreatic cells producing insulin, leading to type 1 diabetes. So if you're worried about what are the symptoms, because I get a lot of questions, messages from parents who are extremely worried when they find these symptoms in their children. So what are these symptoms? Unexpected weight loss in children, excessive bedwetting, lot of thirst, lot of urination, and yes, they're very tired, they're very sleepy. Children becoming very cranky, and they also develop urinary tract infections. Now, these are sort of symptoms which, when a parent observes in a kid, because we have kids as young as 2 years who have visited Alamirap being diagnosed as a type 1 diabetic. The earlier we diagnose, the earlier we understand what the symptoms are, we can ensure that we can reach out to the latest of technology, There's a lot of improvement in technology. You have so many things like a continuous glucose monitor, a CGM, which when applied to the arm, it is something like this. This small sensor, when applied to the arm, it keeps a track of the amount of what is happening in your body, what are your blood sugar counts. This makes it so much more easier to be able to treat a type 1 diabetic. So let's say you have been diagnosed as a type 1. What next? You would require a diabetic management plan. What is this diabetic management plan? What are the things you have to keep in mind when you would have to create a diabetic management plan? First, this is a combined effort. One with the patient, next with the patient's caregiver, third with the doctor, and the fourth with a nutritionist. Using the technology and also understanding how can we best help a type 1 diabetic, we would have to look at it through four major pointers. The first pointer would be what happens when you have a particular combination of food. Identify the best combination. Every single human being is different. So, what suits one person may not suit the other. So, just ensure you identify what are the best combinations for your particular type 1 diabetic patient and make a list of it. The second pointer would be when we say lifestyle management, many people worry whether we have to have physical activity. Yes, physical activity. Exercise is a must, but smart planning is necessary. Whether you should have food, what should your pre-workout be before you go to your exercise, to your workout? What sort of workouts can you do? You can work out like the rest. You can do aerobic exercises, you can do anaerobic exercises, but you should keep a tab of your blood sugars. Try to understand what's happening within your body. The third pointer, which is very, very important, is regular checkups. Keep a tab of your blood sugar ranges, your once in 3 months sugar averages, HbA1c shows you how well your blood sugars are maintained, because the more well maintained they are, the more secondary complications you can avoid in life. Be it, this diabetes, the problem with it, when you go to secondary complications, it starts from the tip of your head, from the top to the tip. Starts with excessive hair fall, starts with blurring of vision, and blindness is a major complication of diabetes. And yes, it is irreversible. So take care of it before you go to that issue. Next, gums. There's a lot of gum issues for a diabetic. We also know the tips of our fingers, our feet, our peripheral should be taken care of, because any small wound does not heal, leads to amputation. Along with this, blood pressure variations, heart problems, stroke, kidney problems. Yes, if you're overweight, you would have to get your weight down, otherwise, again, diabetes management is a problem. Does all this sound too much? Is it worrisome? Please don't worry. Today, you are at the time in life where technology has made huge advances. I myself am a type 2 diabetic since the last 30 years. Unfortunately, when I was diagnosed as a type 2 diabetic, didn't have the technology which we had. I wasn't able to help my near and dear ones since the last 30 years because we didn't know what to do. We only had to do guesswork. But all thanks to technology today, things like continuous glucose monitor, what happens is we are able to understand where we are doing right, where we are going wrong. We're able to tailor make exactly what we can do and ensure as a diabetic we are leading healthier, longer lives. If you or your loved ones in your circle are suffering from any sort of diabetic, be it type 1 or type 2, please don't despair. Help is there. We are there. We will guide you with the things available from your home. So reach out to us, and for more information regarding how to be your healthiest self right from the comfort of your homes, keep watching this place for more. Thank you.